Hey everybody, welcome to another Nurses Outside the Box. So excited to be with Dan Weberg today, who is an executive innovator. I've actually never heard of that, but really welcome to Nurses Outside the Box. Love having you here.
Yeah, thanks so much. I love outside the box thinking, so it's exciting to have the conversation.
So let's dive in. What makes you a nurse outside the box? We've had phenomenal nurses on here, but you really, I feel like you are a nurse outside the box. So what do you think makes you a nurse
I
outside the
mean,
box?
for me, my whole career has been outside the box. I've never really followed the traditional path. I think the traditional path in nursing is be a really good nurse, become a charge nurse, be a manager, be a director, be a chief nurse. Like that's kind of the traditional path, and I've done everything but that. So I've done technology, simulation, innovation, teaching, and now I'm at a startup. And so I've kind of taken the non-traditional path outside the box, and every job along the way, I've tried to be the chief disruption officer in some way, challenging the status quo, not taking the traditions as I should and following the rules, but always trying to find where to break them and do something better and different. So I like to say my spirit animal is MacGyver, and so I've lived up to that.
I love it. I love it. You know, I can feel your energy and it's really fast. I think your thinking is really fast too, if I'm not mistaken. So bring us back a little bit though, because I love to, people always love to hear, what's the story? Yeah, how did you said a lot in a very short sentence about what you've done. Tell us a little more though. What have you done?
Yeah. So I'm an ER and trauma nurse at heart. So that's probably why I talk fast and, and think fast. But yeah, I started off as a new grad in the ER. And, my foray into innovation was really with the development of human patient simulation into nursing schools. And so my senior project as a nursing student was with mannequins and taking the mannequin literally out of the box and figuring out how to program him and use him in scenarios. And that's how I got into the technology side. And then went off to UCLA and worked as a level 1 trauma nurse and went through their residency program and still had this inkling that I wanted to continue along the technology route. So ended up going back to Arizona State University, helping them build their entire simulation center and was, my job title was simulation technology nurse, which I don't think ever existed, but I got to do that. And basically I got to play with the simulator all day and build scenarios and figure out how to make him cry and pee and bleed and do all that kind of stuff. And so we built out a really great program there, and then got into a master's program, master's in healthcare innovation program. And I was in the first cohort to go through that. And that was really, I thought I was going to build the next simulator. And what the program is really about is leadership. And so I kind of got really into leadership science, organizational change, all the theories related to that. And then ended up doing my PhD in that work as well, and got mentorship from two really great people, Tim Porter O'Grady, Kathy Malik, are two really well-known leaders in healthcare. And so I got one-on-one mentorship with them. Had the opportunity to work with Dr. Bern Melnick, who's the evidence-based practice guru. And as she left Arizona State and went to Ohio State, she brought me with her. And I was able to lead nursing education for the Ohio State University health system. And so I got to oversee the service line educators for 4 of the hospitals at Ohio State, really learning about how do we revolutionize competency testing, onboarding, new graduate residency programs. And then out of the blue, got a connection back to California, where I'm from, with Kaiser Permanente, which is a large integrated health system. And they were like, hey, we want you to be our director of nursing innovation. And I was like, I have no idea what Kaiser is, and I have no idea what that job is, but it sounds amazing. And so applied and went through the interview and got the job. And I spent 7.5 years at Kaiser doing everything from strategy to technology assessment to working with startups on pilot programs within the health system. And then the last couple of years got to really build my innovation chops, helping build their new medical school and being the only nurse on the curriculum team for the Kaiser Permanente School of Medicine. And that was amazing. And that class just started on Monday. Their first class ever started on Monday.
I was going to say, I haven't heard it. I've heard of Kaiser Permanente, but I've never heard they actually doing a class.
Yeah. So they have their medical schools built, and I got to help build a lot of it. And yeah, their first class is actually physically in class right now in Pasadena, California. So that was really exciting. And then decided I wanted to kind of jump into something different and joined a startup called Trusted Health, which is a career platform for nurses, kind of a LinkedIn meets Match.com for nurses to manage their career and find jobs of the future.
Wow. All right. So let's look in that for a second, because that's a lot of different changes,
It's a
right? A
lot of
lot of
stuff. Yeah,
innovation. I was
yeah.
like, wow.
That's 15 years of nursing right there.
Woo. Your heart is completely into innovation. So, but I'm curious, what is it that you want to do right now, specifically with this platform, Trusted Health? I'd love to hear
Yeah,
that.
yeah. I mean, for me, I joined Trusted because they want to disrupt the nursing workforce, which I think needs some disruption. Number one, uh, I'm really interested in giving nurses a platform to manage their career. I think
Mhm.
most nurses kind of hack it together through colleagues and friends and maybe a few professional organizations, but they don't have a digital home where you can go, like LinkedIn is for executives. Like you have a place to go find your people and network. Nursing doesn't have that. And
Right.
so I'm excited to build that out. And I think we could do a better job of actually managing the nursing workforce better. I think supply and demand in nursing is really weird and localized, and we don't have data on how many nurses in the state have X many skills, and how do we match those people to the existing needs of health systems all over the state or country or whatever. And so I think the more we can get granular about nurses' skills and competency and actually use that to match them to jobs, I think nurses will be happier. I think patients will be treated better. I think health systems will be more efficient, and ultimately like care gets delivered better. And I think the model we have right now is like, hey, you're a nurse with 5 years. You fit into this 5-year bubble that I've arbitrarily made for this job. And it's just it's not a competency model. And I think we could do way better of matching skill sets to jobs rather than years of service into jobs.
Yeah. And it's interesting talking with Nurse Outside the Box on this podcast. There are some nurses who are doing that, who are actually making much faster leaps and faster twists and turns than any before. So what kind of nurses are you looking for yourself in this platform?
Yeah, I mean, we want all nurses. So our vision is all nurses will be on the Trusted Health platform at some point. I think for the company, when we hire nurses in to help build the platform, we want the ones that are fed up with the current process and willing to challenge every piece of nursing they know, from professional organizations to the way jobs are found to the way nurses are treated. We want people that are willing to kind of build the future of the profession. And so it's really exciting to work with those types of nurses. And then as we get nurses on the platform, I mean, our focus at the moment is travel nursing, but we want to be the career platform for all nurses. So we're rapidly expanding into really interesting things, like we have production companies coming to us saying, hey, we need nurses on set so we can resume filming. We need nurses in this boarding school so that they can go back to school safely in the era of COVID. So we have these non-traditional roles popping up. And I think it's really exciting for nurses to think beyond the bedside, to say, what else is there? Where else can we use nursing knowledge? And we want to match them to those roles.
Wow, I love that. So I want to talk a little bit about COVID too and the results it had, but how do nurses get in touch with you who are interested, who are saying, hey, this looks really good?
Yeah, I mean, trustedhealth.com is the easiest way to find out what we're up to. I've spent most of my time on LinkedIn. So find me at Dan Weberg and LinkedIn, and track me down, follow me, and message me. That's where I spend a lot of my time.
Wonderful. Okay, so we'll put that link in there, and guys, share this with somebody.
Yeah.
Anybody's listening, share that link, because we need more nurses, because I love this platform. What has COVID done for nurses, and what do you think how will it impact the future of nursing? I'm curious about that.
Yeah, I mean, I think it's brought nursing into the limelight to show what we actually do, that we're the frontline caregivers that the country needs beyond in a pandemic and beyond. And so I think that's good. I think it's also highlighted a lot of cracks within the healthcare system, the ways we've let down our frontline workers, and not just nurses, physicians, therapists, like everyone that is treating patients, we've kind of let them down. What we found, we did a survey recently where we surveyed about 1,500 nurses about their experience during COVID and how they feel supported. And the nurses felt they felt very dedicated to nursing, and they felt more connected to the profession than ever, but they didn't feel supported in their mental health and wellness. And so I think we need to do a better job of supporting our frontline workers from a mental health and wellness perspective. And that goes beyond like the employee assistance programs. Like we need structural changes and peer support networks that can support our nurses as they do this amazing work on the front lines. And so I think that's what's been highlighted. So I'm hopeful that this catalyzes some change. And what I've said in the past is, like, the worst thing we could do is go back to normal. And so we have to use this as a catalyst to move forward.
Awesome. I'm curious because you're also a keynote speaker. And I know we have nurses in there who would want to speak. I know there's nurses who want to come out more and do keynote speakers and TEDx talks and everything else.
Mm-hmm.
What do you see nurses do? What would you recommend for nurses to do in that area?
I mean, for me, I fell into it. I mean, I was the person, and I remember my first speech. It was a groundbreaking speech for a new building for this nursing school I was at, and I got to do the groundbreaking, one of the groundbreaking speeches. I remember sitting there holding my speech, shaking, like my hands were physically shaking, and trying to read the word for word lines I wrote. And now I just do like, I walk up on stage, my PowerPoint doesn't work. Like I tell the story, like it doesn't matter. Like it all just flows now. So I think the number one thing is practice, like get up, just the more you do it, the more comfortable you are at it. And I think nurses need to talk about the things they see. I think nurses are really good about innovation and finding workarounds to system problems. They need to talk about that. I think nurses are really good at assessing technologies and devices at the point of care. Like we need to be talking more about that. And I think we need to be talking about how our role can be used outside of what people think we do, which is go to a hospital and treat patients. So we need to talk about those non-traditional roles that nurses have all over the country and world, and highlight that to show that nursing is more than the bedside caregiver 12 hours a day. They're doing amazing things all over the world and changing the way people experience care.
Beautiful. I love it. All right, guys. Well, we're going to wrap up this. I love your enthusiasm. Go to Trusted Health. Anybody who's listening to that, right? Or find Dan on LinkedIn. We'll put the links down below. I want to kind of finish up with the question I always ask. One tip for nurses. If you could if you would have a whole auditorium of 10,000 nurses in front of you right now, what would you say at the end of this?
The biggest thing I would say is network the hell out of each other and make those connections and build your co-conspiracy network. That has been the number one most valuable thing I've ever done in my career, is just say yes to things, meet people, connect with them, and that will lead to opportunities that you can't say no to.
Beautiful. Thank you so much, Dan. And we'll take away that make your co-conspiracy network. I love that. Nobody's ever said that, so I love that. So. I thank so much, Dan. For everybody else, please come to another Nurse Outside the Box and share this, guys. And thanks so much, Dan. It was wonderful.
Yep. Thanks for having me.